Hypoglycemia, Health Guide. Hypoglycemia is a medical condition characterized by an unusually low level of blood sugar, blood glucose. This state triggers the release of various hormones, including epinephrine, adrenaline, and norepinephrine, noradrenaline, aimed at elevating the diminished sugar levels. The initial symptoms of hypoglycemia involve manifestations such as tremors, sweating, rapid heartbeat, and anxiety. Given the brain's reliance on blood sugar as its primary energy source, untreated hypoglycemia can impede proper brain function, leading to consequences like blurred vision, difficulty concentrating, and, in severe cases, loss of consciousness and convulsions, seizures. Causes of hypoglycemia. Primarily observed in individuals with diabetes undergoing specific medication regimens, hypoglycemia arises from factors such as excessive insulin dosage, the use of sulfonylureas, for example, glyburide, glipizide, or alterations in diet and exercise, without corresponding adjustments to glucose-lowering medications. Both insulin and exercise decrease blood sugar, while carbohydrate-rich foods elevate it. Hypoglycemia can also occur, though infrequently, in non-diabetic individuals due to various medical conditions. Gastrointestinal surgery, including weight loss procedures, can disrupt the normal digestive insulin-release relationship. Pancreatic tumors, specifically insulinomas, abnormally secrete insulin. Deficiencies in growth hormone from the pituitary gland or cortisol from the adrenal glands can disturb blood sugar balance. Factors like alcohol, aspirin overdose, severe liver disease, and the inappropriate use of insulin by non-diabetics. Rare cancers producing insulin-like substances or enzyme defects related to glucose regulation. Symptoms of hypoglycemia. Early warning signs. Sweating, profuse sweating, especially on the forehead or upper body. Trembling or shaking, involuntary trembling or shaking, often in the hands. Rapid heartbeat, an increased heart rate or palpitations may occur. Neurological symptoms. Headache, a persistent or sudden headache can be an early indicator. Dizziness, feeling lightheaded or dizzy may accompany low blood sugar. Blurred vision, vision impairment or difficulty focusing on objects. Difficulty concentrating, impaired concentration and mental clarity. Confusion, disorientation, difficulty processing information, or mental fog. Abnormal behavior, unusual or erratic behavior may be observed. Physical manifestations. Weakness or fatigue, a sudden feeling of weakness or extreme tiredness. Fainting or loss of consciousness. In severe cases, hypoglycemia can lead to loss of consciousness. Tingling sensations, numbness or tingling, often in the lips, tongue, or hands. Poor coordination, difficulty coordinating movements, stumbling, or lack of balance. Gastrointestinal symptoms. Hunger, intense hunger or a feeling of emptiness in the stomach. Nausea, feeling queasy or nauseous. Abdominal discomfort, discomfort or cramping in the abdominal region. Behavioral changes. Irritability, sudden mood changes, increased irritability, or heightened emotional sensitivity. Anxiety, feeling anxious, restless, or a sense of impending doom. Personality changes, noticeable shifts in behavior or personality. Speech and communication. Confused speech, difficulty articulating thoughts, slurred speech, or confusion in communication. Abnormal vocalization, unusual vocal patterns or difficulty in coherent conversation. Severe symptoms. Convulsions, seizures, in extreme cases, hypoglycemia can lead to convulsions or seizures. Loss of consciousness, prolonged hypoglycemia may result in loss of consciousness. Risk signs and factors. Diabetes treatment. Insulin and sulfonylureas, individuals with diabetes treated with insulin or sulfonylureas are at a higher risk, especially if medication doses are too high or not synchronized with meals and activities. Medical conditions. Pancreatic tumors, insulinomas, tumors in the pancreas that secrete excess insulin can lead to hypoglycemia. Gastrointestinal surgery, procedures like weight loss surgery that alter digestion and insulin release may increase the risk. Hormonal imbalances. Deficiency of growth hormone or cortisol, imbalances in these hormones can disrupt blood sugar regulation. Medication and substance use. Alcohol consumption, drinking alcohol, especially on an empty stomach or in excess, can lead to low blood sugar. Overdose of aspirin, excessive use of aspirin may contribute to hypoglycemia. Use of insulin without diabetes, incorrect use of insulin by individuals without diabetes can lead to low blood sugar. Liver and enzyme defects. Severe liver disease. Liver dysfunction can impact glucose production. Enzyme defects. Rare enzyme defects, such as in glucose 6-phosphatase, liver phosphorylase, or pyruvate carboxylase, may contribute. Rare cancers. Insulin-secreting cancers. Certain rare cancers can produce substances similar to insulin, leading to hypoglycemia. Hypoglycemia unrelated to diabetes. Reactive hypoglycemia occurs after meals, unrelated to diabetes, and may be linked to an exaggerated insulin response. Age and duration of diabetes. Elderly individuals, older adults, especially those taking multiple medications, may be more vulnerable. Long duration of diabetes. Those with diabetes for an extended period are at risk of hypoglycemia unawareness. Exercise intensity. Vigorous physical activity. Intense exercise without adjusting insulin or food intake can lead to hypoglycemia. Diagnosis. For individuals with diabetes experiencing severe hypoglycemia, a detailed medical history and insulin regimen analysis may be challenging due to confusion or unconsciousness. In such cases, family members or close friends play a crucial role in providing relevant information. To facilitate effective emergency treatment, individuals with diabetes on insulin or sulfonylureas are advised to wear medical alert bracelets. This identification can be vital, especially when the patient is away from home or traveling alone. Family members or friends should be knowledgeable about bringing a person out of severe hypoglycemia. Utilizing methods such as administering orange juice, providing other sources of carbohydrates, or using a glucagon injection. When the patient can respond, doctors inquire about medication details, recent dietary habits, and exercise routines. Self-monitoring devices, such as glucometers, aid in reviewing recent blood sugar readings to confirm low blood sugar and identify patterns related to medication, diet, or exercise. In non-diabetic individuals, diagnostic testing ideally occurs during symptomatic episodes. Blood tests measure glucose levels, insulin, cortisol, and thyroid hormones. For suspected insulinomas, a supervised 48-hour fast may be conducted, with blood glucose and insulin monitoring. Accidental use of insulin or diabetic drugs may also contribute to hypoglycemia. Expected duration. The duration of hypoglycemic episodes varies based on causative factors. Short-acting insulin-induced hypoglycemia, triggered by exercise or excess insulin, can often be quickly resolved with the consumption of rapidly absorbable sugar. However, hypoglycemia from sulfonylureas or long-acting insulin may persist and even recur after initial treatment. Prolonged or recurrent episodes, particularly at night, pose risks of impaired brain function over time. About 85% of insulinoma patients can be cured of hypoglycemia following the removal of the insulin-secreting tumor. Non-diabetic individuals with hypoglycemic-like symptoms may not necessarily have low blood sugar. Anxiety and other factors can mimic these symptoms. Prevention strategies involve maintaining regular meal times, avoiding meal skipping, and sustaining a consistent exercise routine. Prevention. Regular monitoring and self-management. Encourage consistent blood sugar monitoring. Advocate for individuals with diabetes to incorporate regular blood sugar monitoring into their self-management routine. This proactive measure allows for the early detection of fluctuations, enabling timely intervention to prevent hypoglycemia. Individualized meal planning. Emphasize importance of individualized plans. Stress the crucial role of individualized meal planning with the guidance of healthcare professionals. Customizing meal plans to suit individual preferences, dietary needs, and medication schedules is key to maintaining stable blood sugar levels throughout the day. Consistent meal timing. Highlight significance of timing. Emphasize the significance of maintaining consistent meal times. Irregular eating patterns, such as skipping meals or delayed meals, can contribute to hypoglycemia. Establishing a routine for meals and snacks helps prevent sudden drops in blood sugar. Education on alcohol consumption. Inform about alcohol's impact. Educate individuals about the potential impact of alcohol on blood sugar levels. Discuss the importance of moderation and the necessity of consuming alcohol with food to prevent hypoglycemia. Emphasize the need for awareness, especially if alcohol is consumed in the presence of diabetes medications. Adjusting medications with lifestyle changes. Communicate changes with healthcare providers. Emphasize the importance of communicating with healthcare providers when making significant lifestyle changes, such as alterations in diet or exercise routines. Changes in lifestyle may necessitate adjustments to medication dosages to avoid the risk of hypoglycemia. Emergency preparedness. Guidance on hypoglycemia emergency kit. Provide guidance on creating a hypoglycemia emergency kit. This kit should include fast-acting sources of glucose, such as glucose tablets or gel, along with essential medical information, emergency contacts, and instructions on how to administer glucagon. Technology integration. Explore technological solutions. Explore the integration of technology in diabetes management. Discuss the benefits of continuous glucose monitoring, CGM, systems, insulin pumps, and smartphone apps that provide real-time data and alerts. These technological advancements aid individuals in making informed decisions to prevent hypoglycemia. Education on hypoglycemia symptoms. Ensure symptom awareness. Ensure that individuals are well informed about the symptoms of hypoglycemia. This includes both early warning signs, such as sweating, trembling, and rapid heartbeat, and more severe symptoms like confusion and loss of consciousness. Early recognition enables timely intervention. Collaborative care with healthcare providers. Stress open communication. Stress the importance of open communication and collaboration with healthcare providers. Regular checkups, discussions about lifestyle changes, and proactive communication about any concerns or challenges contribute to effective prevention strategies. Lifestyle modification programs. Promote holistic well-being. Promote participation in lifestyle modification programs that focus on holistic well-being. These programs may include elements such as nutrition education, stress management, and physical activity guidance to empower individuals in preventing hypoglycemia through a comprehensive approach. Addressing mental health. Recognize mental health impact. Acknowledge the impact of mental health on diabetes management. Encourage individuals to seek support for stress, anxiety, or depression, as these factors can influence blood sugar levels. Mental well-being is integral to the overall prevention strategy. Sleep hygiene. Highlight importance of good sleep. Discuss the importance of maintaining good sleep hygiene. Adequate and consistent sleep contributes to overall health and can help regulate blood sugar levels. Encourage individuals to prioritize sleep and address any sleep-related concerns with healthcare providers. Carrying fast-acting sugar. Always be prepared. Highlight the significance of always carrying a source of fast-acting sugar, such as glucose gel or a small snack. This proactive approach ensures readiness to address unexpected hypoglycemic events wherever they may occur. Treatment. Immediate response. Prompt action. Emphasize the critical importance of taking swift action during hypoglycemic episodes. Individuals should consume rapidly absorbable sugar, such as glucose tablets, candies, or fruit juice, to raise blood sugar levels quickly. Carrying fast-acting sugar. Highlight the significance of always carrying a source of fast-acting sugar, such as glucose gel or a small snack. This proactive approach ensures readiness to address unexpected hypoglycemic events wherever they may occur. Adjusting medications. Healthcare provider involvement. Discuss the pivotal role of healthcare providers in adjusting medication regimens, particularly insulin doses. This may involve modifying the timing or dosage of medications based on factors like meal schedules and physical activity. Regular follow-up appointments. Highlight the importance of regular follow-up appointments with healthcare professionals. These appointments serve to monitor blood sugar levels and make necessary adjustments to the treatment plan, ensuring optimal management. Management of hypoglycemic unawareness. Vigilant blood sugar monitoring. Address the challenge of hypoglycemic unawareness, where individuals may not experience typical early warning symptoms. Encourage vigilant blood sugar monitoring and more frequent checks, especially in high-risk situations. Continuous glucose monitoring, CGM, systems. Discuss the potential use of continuous glucose monitoring, CGM, systems, as an advanced tool for real-time monitoring. These systems can aid in the early detection of fluctuations and proactive management. Emergency interventions. Guidance on glucagon administration. Provide clear guidance on emergency interventions, including the administration of glucagon. Explain how glucagon raises blood sugar levels and train individuals and their close contacts, such as family members, on the proper administration in case of severe hypoglycemia. Importance of glucagon emergency kit. Discuss the crucial importance of having a glucagon emergency kit at home. Ensure that family members, friends, or colleagues are aware of its location and know how to use it effectively. Lifestyle modifications. Role of regular lifestyle practices. Emphasize the integral role of lifestyle modifications in preventing hypoglycemia. This includes maintaining regular meal times, avoiding skipped meals, and incorporating consistent exercise into daily routines. Education on alcohol impact. Educate individuals on the impact of alcohol consumption on blood sugar levels and the need for moderation. Stress the benefits of a well-balanced diet that includes a mix of carbohydrates, proteins, and healthy fats. Individualized care plans. Tailored treatment strategies. Stress the paramount importance of individualized care plans tailored to each person's unique needs. Collaborate with healthcare providers to create personalized treatment strategies, considering factors such as age, lifestyle, coexisting medical conditions, and medication preferences. Open communication with healthcare professionals. Encourage open communication with healthcare professionals about any challenges or concerns regarding the treatment plan. This collaboration ensures a dynamic and responsive approach to managing hypoglycemia. Surgical interventions. Necessity of surgical intervention. In cases where hypoglycemia is caused by conditions like insulinomas, convey the necessity of surgical intervention. Provide information on the surgical removal of insulin-secreting tumors and discuss the expected outcomes in terms of improved blood sugar control. Pre- and postoperative care. Discuss the importance of thorough preoperative assessments and comprehensive postoperative care. This ensures a holistic approach to managing hypoglycemia in the long term. Long-term monitoring and prevention. Ongoing monitoring. Highlight the ongoing need for monitoring and preventive measures to manage hypoglycemia over the long term. Stress the importance of regular checkups, blood sugar monitoring, and continuous communication with healthcare providers as essential components of successful long-term management. Consequences of severe episodes. Emphasize the potential consequences of repeated severe hypoglycemic episodes on cognitive function and overall well-being. Underscore the importance of proactive management to mitigate long-term risks. Your health matters. Quali.health